Hello aspirants, welcome to GDC English classes and welcome to English class YouTube channel. So in this session, we will discuss MCQs from the pharmacology from Gpat 2025 question paper. So for success in the competitive examination, it may be Gpat, Sniper, Drug Inspector, Pharmacist. So it is very important after listening the class, revise the class and practice the MCQs. Once you have a confidence on the total subject like pharmacology and you are ready to going for the exams or you want to know how the questions may appear in the exams, from which topic, from which corner they are asking the questions. So like that purpose, you have to must to follow the questions along with their explanation from previous year question papers. So GDC is always in front row to make that always possible to the students in the form of videos, recorded lectures, in the form of live classes, MCQ sessions, etc. You know that already. So GDC nothing but GDC is always content as well as quality. And always, so don't think that, okay, this 1 year I will study for the GPAT. Okay, this 1 year if I will study, I will crack the GPAT, never, etc. Okay, very good. So this 1 year you will study GPAT for GPAT, never, that's perfect. But think for next 10 years. Okay, what the knowledge I am learning now in this 1 year of GPAT preparation, NIPER preparation, pharmacist preparation, drug inspector preparation, this should be utilized for me. So through the GPAT, you can go for NIPER. So in the NIPER, how I can make this knowledge into the research and into the product. Sure, we have to think, we have to believe. Always the Abdul Kalams are told one thing only. So we have to believe in ourselves and we have to go forward and the impossible things make possible. So like here also, you are preparing for GPAT and NIPER for 1 year. So you have to be very cautious and very focused in this 1 year. And definitely you are doing that and that will be directly proportional to your next upcoming years of financial and professional growth. So that knowledge you can make into a research, that research into become a bigger product which can give you a permanent solution for the many uh, severe disease like diabetes wound healing, diabetic wounds, rheumatoid arthritis, infertility. There are many conditions are there. So always, yes, you are preparing for 1 year, but that 1 year preparation should be on the focus. You have to learn more knowledge, basics and concepts, and definitely that 1 year will make you go into the next few years in the form of excellent professional as well as financial growth. Okay, so genius is only 1% and the 99% is the how much the energy, how much the knowledge you are implementing into your next career growth. Okay, all the best. And let's enter into the session. So regarding our discussion on first MCQ. So what is the first MCQ is match the following question. So regarding the match the following, here it is they given mechanism of action and here it is a drug name. Here it is the drug name. So first inhibits arabinosyl transferases, inhibits DNA dependent RNA polymerase, inhibits folic acid synthase, inhibits mycobacterial ATP synthase. Mycobacterial ATP synthase. So what is the options? So generally inhibition of arabinosyl transferase will goes to the ethambutol, a antimycobacterial drug helps in the treatment of TB. And coming to the inhibits DNA dependent RNA polymerase, that is rifampicin. Rifampicin is an antibiotic, helps in the treatment of tuberculosis as well as leprosy. And folate synthase. Folate synthase inhibited by the para-aminosalicylic acid. Commonly it is known as PASA. It is also second line anti-tubercular drug. And inhibits mycobacterial ATP synthase will goes to the bedaquiline, a recently approved drug for treatment of tuberculosis, especially multi-drug resistant tuberculosis. So here simply, so one is C. So one is C and two is A. One is C, two is A and three is D. Three is D and four is the B. Four is the B. So one is C, two is A, three is the D and four is the B. The answer is going for the Option B. Option B. Option B is the answer. You can clearly check here. And here, clearly, so rifampicin, a antibiotic, especially inhibit DNA-dependent RNA polymerase. And bedaquiline inhibit mycobacterial ATP synthase and limit the energy production within the mycobacterial cell. So tuberculosis, leprosy caused by mycobacterium. Mycobacterium is a unique bacterium. It is known as acid-fast bacterium. And its staining also acid-fast staining. And ethambutol, one of the drug inhibit arabinosyl transferase, helps in the treatment of tuberculosis. And para-aminosalicylic acid, one of the common drug, decrease the folic acid synthesis in the bacterium. Okay. Next, second question. So this is from the anatomy point of view. What is the fasting physiological pH value in the jejunum? So jejunum is related to the intestine. Intestine generally having the basic pH. What is the fasting physiological pH? In the fasting condition, what is the pH in the jejunum area like intestine? Generally intestinal area having pH near to the basic value, not more than the basic levels, near to the basic. So 4.8 plus or minus 0.4, 6.8 plus or minus 0.4, 3.2 plus or minus 0.4, 8.6 plus or minus 0.4. 8.6 is more than the basic, but near the basic it is 6.8. So this is the answer. The fasting physiological pH in the jejunum, a part of the intestine. So answer is option B. So here it is a clear explanation. Stomach average pH 1.3 and average pH fasting 4.9. Duodenum 6.5 average and fasting will be the 5.4. Jejunum 6.6 and average fasting 5.2. And sorry, it is a fasting and it is a fed. Sorry for inconvenience. It is a nothing but a fed after meals. So with meals. And this is without meals. This is a fasting condition. These are the pH for the fasting condition. These are the pH during the food present in the stomach, nothing but particular area of the GIT. Next, furosemide inhibits. So you know that furosemide, one of the diuretic, one of the loop diuretic, especially acts on the thick ascending limb of loop of Henle of nephron, and it is a commonly used diuretic, and it is also known as a loop diuretic and having high potency at low dose shows excellent action. So furosemide, they are asking regarding the mechanism of furosemide. Furosemide inhibits the sodium potassium cotransporter in distal nephron and tubule, the sodium chloride cotransporter in the distal convoluted tubule, the sodium channel controlled by aldosterone protein mediator, the sodium potassium 2 chloride cotransporter in the ascending limb of loop of Henle, thick ascending limb of loop of Henle. So the answer is furosemide inhibits sodium potassium 2 chloride cotransporter and helps in the formation of more urine. Helps in the formation of more urine. So as you know that it inhibit the sodium potassium. It inhibit the sodium potassium 2 chloride transport, especially acts on the thick ascending limb of loop of Henle, and these are also called as loop diuretics and also known as high efficacy diuretics. Efficacy nothing but action, pharmacological action. High efficacy diuretics, high potent diuretics among the all diuretics. Okay, next. So next question is, which of the following is a peroxisome proliferator activated receptor gamma agonist? Okay, there is a PPR receptor, PPAR alpha as well as PPR gamma, and these are subtypes of a nuclear receptor, class 2 nuclear receptor. These are subtypes of a class 2 nuclear receptor. Nuclear receptors also known as steroid receptor. So this PPR are fatty acids. So here this class 2 nuclear receptors also known as fatty acid receptors. So here which of the following drug bind to this peroxisomal proliferative receptor, and this is the subtype is here gamma, PPR gamma agonist. Acarbose antidiabetic, metformin antidiabetic, Sulfonylurea antidiabetic. Pioglitazone antidiabetic. Pioglitazones chemically glitazones. Thiazolidine what they will do, they bind to the PPR gamma receptors and they helps in the treatment of diabetes by reducing excess blood glucose levels by interacting with the genetic level, interacting at a genetic level. So pioglitazone is a drug bind to the PPR gamma receptors. So here, so simply the answer is pioglitazone. Pioglitazone binds to the PPR gamma receptor and this is a classification of anti-diabetic. Enhance insulin secretion. Potassium ATP channel blockers. Potassium ATP channel blockers like sulfonylureas, meglitinide, phenylalanine derivatives. So this meglitinide, phenylalanine derivatives are non-sulfonylureas. And dipeptidyl, peptidase 4 inhibitor, DPP4 inhibitor, all gliptins. Sitagliptin, vildagliptin, saxagliptin, teneligliptin. Next, overcome insulin resistance. So, increase the function of insulin by drugs like biguanides, metformin, thiazolidine, pioglitazone, and alpha glucosidase inhibitor. So, and miscellaneous category, alpha glucosidase inhibitor, dopamine, type 2 dopamine agonist, and sodium glucose transporter 2 inhibitors also. So, you can go through clearly by passing your video. Next question. So regarding the next question, select the proper sequence from start of contraction regarding skeletal muscle contraction. Regarding skeletal muscle contraction. So, release of calcium from sarcoplasmic reticulum, change in the potential, stimulation of motor end plate with acetylcholine. Troponin binds with calcium causing exposing binding sites for myosin. Actin and myosin cross bridge leads to power stroke. Leads to power stroke. So stimulation of motor end plate with acetylcholine. First motor end plate. So skeletal muscle. Skeletal muscle. So there is a neuromuscular junction between the neuron and skeletal muscle. The neuron is motor neuron, the muscle is the skeletal muscle, and on the muscle there is a end plate. Motor neuron supplies to the end plate. Motor end plate skeletal muscle. So for that purpose, first there should be release of acetylcholine, stimulation of motor end plate with acetylcholine. And when it is happen, there is release of calcium from the sarcoplasmic reticulum after change in the potential. After that, troponin binds with the calcium causing expose of binding sites for myosin. After that, actin myosin cross bridge leads to power stroke, muscle contraction. So the answer will go to the BACD. BACD is the answer. So sequence BACD is a sequence of skeletal muscle contraction. Initially, there should be a release of acetylcholine for stimulation because acetylcholine causes skeletal muscle contraction by stimulating NM receptor, nicotinic muscle receptors on the skeletal muscle. Answer is option B. Okay. Yes, you can go through the clear answer by passing the video. Next question. So regarding the next question, match the following again. So this match the following is easy. So regarding pancreatic cells, different pancreatic cells are there. So regarding the different pancreatic cells, alpha cells releases glucagon, beta cells releases somatostatin, beta cells releases proinsulin, delta cells releases somatostatin, G cells releases gastrin, G cells releases gastrin. So 1A and alpha cells glucagon, beta cells proinsulin, 2D. So 1A, 2D, 1A, 2D, and delta cells releases somatostatin, that is 3B, and G cells releases gastrin, C, 4C. So if you observe, sometimes match the following is a little bit easy and crazy. So if you observe, G cells releases gastrin, that is fixed, sure. So 4C present only in the option 1 only. Okay, like that also you can identify. So it will make easy for answering and it will also reduce the time also, reduce the time consumption. Okay, so answer is the option A. That is a simple, and this is also simple question. You can answer easily also. So that is regarding explanation. Next, match the following. So here the question is regarding anti-arrhythmic drugs classification. Question is regarding the anti-arrhythmic classification. So class 1 anti-arrhythmic, class 2 antiarrhythmic, class 3, class 4. So if you observe class 4 verapamil S. Verapamil is a calcium channel blocker, comes under class 4 antiarrhythmic. And class 3 antiarrhythmic amiodarone. Amiodarone is the class 3 antiarrhythmic. They are potassium channel blockers. And coming to the class 2, metoprolol. Metoprolol is a beta blocker. Beta blockers are class 2 antiarrhythmic. And class 1 disopyramide. Disopyramide is the class 1 antiarrhythmic. It is a sodium channel blocker. Acts on the phase 0 of cardiac action potential. Okay. So clear? The answer is 1A, 2B, 3C, 4D. A, B, C, D. So A, B, C, D is present in the option A. The answer is option A. So sometimes the matching will be easy directly like this. Sometimes they will given in the easy form only, but you have to use your brain, your consciousness. Okay, I told you that. So definitely one option will be correct. That one option given in the one option only. Like before we discussed about alpha cells, beta cells. So option 4, C, like that. Okay. And always open your blood-brain barrier, because when you open your blood-brain barrier, the basics and concepts are like lipophilic. They reaches your blood-brain barrier easily. Yes, this is a classification of anti-arrhythmic drug like class 1, class 2, class 3, class 4 examples. Clearly go through it once. Next question is, which of the following drugs, when given with warfarin, induces hepatic P450 enzymes? So warfarin is an anticoagulant. So in which of the following drugs, if warfarin is combined, co-administered, there is a chance of increasing there is a chance of induces, means increasing CYP450 enzymes. So amiodarone antiarrhythmic, ciprofloxacin antibiotic, carbamazepine antiepileptic, metronidazole. So among this, if you observe, among this carbamazepine a antiepileptic, it is a enzyme inducer. It can increase the levels of CYP450 enzymes, and carbamazepine also known as a self enzyme inducer. Self-enzyme inducer. So this carbamazepine increase the levels of CYP enzymes, and it will increase the metabolism of warfarin, and warfarin may eliminate immediately from the body without showing its action. The answer is very simple. Carbamazepine induces CYP450 enzymes. So be cautious if you want to combine carbamazepine with other drug, because carbamazepine increases CYP level enzymes. That CYP enzymes may increase the other drug metabolism rapidly, and decrease the levels of drug, and decrease the response of a particular drug. So warfarin is an anticoagulant. The answer is option C. So here it is a with a interesting trick we made here. So enzyme inducers which may increases CYP enzyme levels with a trick G3P3RS cell phone, GPRS cell phone. These are the list of the drugs. So here it is a carbamazepine. And these are the enzyme inhibitors. These drugs decrease the levels of CYP450 enzymes with a trick sickface.com. So this is a very important table. So please make a screenshot and remember, definitely you will get questions in the examination. And you know that there is a third edition of Gpat mantra also released. The Gpat mantra contains all previous year question papers, nearly 30 plus previous year question papers from the 30 years, nearly 35 years. Definitely it is a wonderful book to crack your Gpat, NIPER and all pharmacompetitive exams. Next. So here BPALM, B-palm regimen is a combination of following drugs. B-palm regimen is a combination of following drugs. So that is simply, so bedaquiline petomanid, linezolid, moxifloxacin, bedaquiline, pyrazinamide, linezolid, moxifloxacin, bedaquiline, pyrazinamide, levofloxacin, moxifloxacin, bedaquiline, petomanid, linezolid, montelukast. So this is mainly for this B-PARM regimen is mainly for the treatment of a multi-drug resistant tuberculosis as well as a leprosy. So the answer is bedaquiline, pretomanid, linezolid, moxifloxacin is a composition in this B-PARM. Is a composition in this B-PARM. That is answer is option A. So bedaquiline inhibit the mycobacterial ATP synthase. PA, pretomanid, nitroimidazooxazine disrupts mycobacterial cell wall. L, linezolid, oxazolinone inhibit the bacterial protein synthesis. M, moxifloxacin, a fluoroquinolone inhibit the DNA carriers in the bacteria. So generally this B-PARM regimen is a 6 months long fully oral used in multi-drug resistant tuberculosis patient, and it is effective and less toxic compared to remaining drugs and remaining combinations. Okay. So regarding the explanation, by pause the video and please go through clearly. Next. Regarding next MCQ, again here also matching. So here it is a class anti-cancer drugs and here it is drug example. So alkylating agent. So alkylating agent is generally here mechlorethamine, platinum analog, cisplatin, anti-metabolite, 5-fluorouracil, growth factor receptor inhibitor, cetuximab. Generally, so matching questions are nowadays they are making easy. Yes, the students are very focused. They are preparing well. That's I will agree. That's true. But like this easy not appeared in the previous years. But anyway, so luck is not always in favor to us. Always depend on the basics concepts. Whatever the topic you are studied, close the book, revise the things. If you forgetting anything, again open the book and revise the things. And if you have a strong impression on particular topic, confidence on particular topic, go and practice the MCQs. After practicing MCQs with in detail, okay, why this is only answer, why these three options are not answered like that. After excellent participation in the MCQ session, practicing MCQ session, come back and revise again. So study the topic, get confidence on the topic, close the book, revise the things. If you have any doubts, again open the book and revise. If you have a perfect confidence, go to the MCQs, practice the MCQs in detail, and again come back to review of particular topic. So please practice this for all subjects. And one of the important thing to succeed in the Gpat NIPER examination, practice on the paper while studying. And this practice definitely is reflecting for your future professional as well as financial growth. 100% believe in yourself, believe the things, practice on the paper. That is the sure. Okay, so the answer is very, very clear. So 1A, 2B, 3C, 4D, A, B, C, D, A, B, C, D, option A. Answer is option A. Clear? So here, so this is the classification of anti-cancer drugs. So like alkylating agents, so anti-metabolites, platinum compounds, so microtubule damaging, plant derivatives, etc., etc. Next, which one of the following antiplatelet drug acts by P2Y12 receptor antagonism, like tirofiban, aspirin, dipyridamole, clopidogrel? All these are antiplatelet drugs. They prevent the function of platelets and prevent the formation of clots. Tirofiban, aspirin, dipyridamole, clopidogrel. But among here, clopidogrel is a P2Y12R adenosine receptor antagonist and prevents the aggregation of platelets, prevents the clot formation through platelet aggregation, interfere with the clot formation. The answer is very clear. Clopidogrel. Clopidogrel is the answer. And here it is the so aspirin inhibit thromboxane synthesis and dipyridamole platelet cyclic AMP enhancer increases cyclic AMP. Increased cyclic AMP increases platelet aggregation. And yes, P2Y12 receptor blocker, clopidogrel, ticlopidogrel, prasugrel, and glycoprotein 2B3A antagonist, opsiximab, tirofiban, eptifibatide. Okay, next. So regarding the next MCQ, mirabegron is a primarily used in treatment of overactive bladder. It is well known as overactive bladder. Overactive bladder is because of excess parasympathetic function. So excess release of acetylcholine or urinary bladder unwantedly, unneededly stimulate urinary bladder, feeling like a continuous urination, even you went for the washroom also. After coming from the washroom also, immediately you will feel urination because of excess stimulation of urinary bladder. The excess stimulation of overactive urinary bladder is because of excess parasympathetic function due to excess acetylcholine stimulation of smooth muscle of urinary bladder. That overactive urinary bladder should be treated by using sympathomimetics like mirabegron. So mirabegron is a selective M3 receptor antagonist, beta 3 selective adrenergic receptor agonist, non-selective alpha blocker, beta 2 selective adrenergic receptor blocker. So mirabegron, solabegron, SOLE, amibegron, AME. So all begrons are selective beta 3 receptor agonist on the urinary bladder. So beta 3 receptors are located on the adipose tissue as well as urinary bladder also. So sympathetic nervous system through the beta 3 receptor relax the urinary bladder and helps in the treatment of overactive or excess functioning urinary bladder. I hope you are getting my points. If anything is there, so kindly comment in the comment box. Definitely your feedback, your suggestions will help us to reach more towards you. Okay. So yes, there are background, amibegron, solabegron, all these are selective beta 3 receptor agonist. They helps in the treatment of overactive bladder. They reduce the function of excess functioning bladder. So these are the locations of beta 1, beta 2, beta 3 receptor. Beta 3 located on adipose tissue, detrusor muscle of urinary bladder. And mirabegron is the selective beta 3 receptor agonist. Next question. Which one of the following is an antidote for organophosphorus poisoning? So organophosphorus compounds like malathion, parathion, these organophosphorus compounds you gone through in the parasympathetic nervous system. If these organophosphorus compounds are excess in the body, they increases acetylcholine function abnormally and increases severe parasympathetic nervous system side effect like excess meiosis, excess salivary secretion, decreasing heart function, excess bronchial contraction, excess gastric movements leads to diarrhea, excess urinary bladder movement leads to unwanted urination, excess parasympathetic method, excess acetylcholine levels in the body because of organophosphorus poisoning. Which are the following drugs? Sodium thiosulfate, pralidoxime, physostigmine, naloxone. Naloxone opioid antagonist, physostigmine parasympathomimetic inhibit acetylcholine esterase enzyme. Pralidoxime is a enzyme reactivator. It will reactivate the acetylcholine esterase and by reactivate immediately rapidly decrease acetylcholine levels by its degradation because organophosphorus poisoning characterized by excess acetylcholine levels. That excess acetylcholine levels should be rapidly decreased by pralidoxime. Pralidoxime rapidly activate acetylcholine esterase enzyme, spontaneously decrease acetylcholine levels. Pralidoxime is a acetylcholine esterase enzyme reactivator, helps in the treatment of organophosphorus poisoning. So this is simply organophosphorus poisoning. The symptoms like meiosis, salivation, bronchospasm, epilepsy, and coma and paralysis also. Okay, go through the explanation by passing your video. So what is the treatment? What is the procedure to follow for organophosphorus poisoning? So atropine block the muscarinic receptor. cholinesterase reactivator, enzyme reactivator, oxime, prolidoxime, obidoxime, diacetyl monoxime. Okay, next. Which of the following anticonvulsant drugs act on the selective molecule pathway? Which of the following all are anticonvulsant drugs? They act on the selective molecular pathway. So gabapentin increase the GABA function. Pregabalin also promote the GABA function. Lamotrigine, like generally it is a antiepileptic drug. And tiagabin. So tiagabin inhibits GAT1, ZAT1 GAT1. So GAT1 nothing but GABA transporter 1. So this tiagabin inhibit the GABA transporter 1 and prevent the reuptake of GABA from pre-synapse to post-synapse, because in the treatment of epilepsy there is a more levels of GABA should be present in the post-synapse, directly bind to the receptor and produce inhibitory neurotransmission in the patient, reduce the epilepsy. So here the reuptake of GABA from post-synapse to pre-synapse carried out by GABA transporter. If this GABA transporter inhibited, no reuptake of GABA, more amount of GABA is present at the post-synapse, helps in the treatment of epilepsy by producing inhibitory signals. I hope you are getting my points. So tiagabin acts on the molecular target. Answer is the option D. Option D is the answer. So here it is the explanation. It is a newer anticonvulsant potentiate GABA mediated neuronal inhibition by inhibiting GAT1, GABA transporter 1, and increase more levels of GABA in the synapse. Helps in the treatment. Okay. So please go through the explanation in detail. If I explain in detail, it will take the number of hours. Okay. But I am giving the essential points to you. If you open your blood-brain barrier. So vigabatrin is an inhibitor of vigabatrin. Vigabatrin, VI, vinyl, GABA. That is gamma aminobutyric acid. And TR, transaminase, IN inhibitor, transaminase. So simply, so like that you can decode these drugs easily. So VI nothing but vinyl, GABA GABA, TR transaminase, IN inhibitor. Vigabatrin is a vinyl GABA derivative that inhibits the transaminase, GABA transaminase enzyme. What is GABA transaminase enzyme? GABA transaminase is enzyme responsible for degradation of GABA. If GABA degraded, decreasing GABA levels, but increasing GABA levels is the requirement in epilepsy treatment. So vigabatrin inhibit chloride channels, GABA synthase, voltage gated sodium channel, GABA transaminase. By inhibiting GABA transaminase, it will increase the GABA levels by decreasing its metabolism. The answer is very clear. That is option D. Option D is the answer. Vigabatrin inhibitor of GABA transaminase. So inhibit the GABA transaminase, that the enzyme responsible for metabolism of GABA. But inhibition of this enzyme increase the levels of GABA due to decreasing its metabolism. Okay. So I hope you have awareness regarding this Gpat mantra book. Definitely it will help you crack your Gpat as well as sniper easily. Next. What is the effect of co-administering diltiazem with cyclosporin? Diltiazem with the cyclosporin. So what happens if cyclosporin and diltiazem combined? Diltiazem, it is a class 4 antiarrhythmic drug, calcium channel blocker, and cyclosporin, a immunosuppressant, helps in the treatment of helps during organ transplantation and also helps in autoimmune diseases also. So when these two drugs combine, decreased blood levels of cyclosporin, increased blood levels of cyclosporin, no interaction between the two drugs, increased nephrotoxicity of the diltiazem. So diltiazem does not cause nephrotoxicity. Remove that. No interaction. Definitely there is an interaction. And increased blood levels of cyclosporin, decreased blood levels of cyclosporin. Generally, both diltiazem cyclosporin metabolized by the CYP3A4 enzyme. Both Diltiazem as well as cyclosporin metabolized by the CYP3A4 enzyme. So both are at a time compete for same enzyme for metabolism. In that competition, diltiazem winning the race, but cyclosporin cannot. So diltiazem going for the metabolism, cyclosporin stays there because of that cyclosporin levels are increased in the blood because of competition for same enzyme. Competition for same enzyme. So increased levels of cyclosporin in the blood when combined with diltiazem. That's why drug interactions are very important. The pharmacist who are going to prescribe the drugs, he should have knowledge on that. He should have knowledge on that. Otherwise, it is a problematic to the patient who are taking the drug. So go through this simply. Both are compete for the same enzyme. In a study, 50% of women diagnosed with venous thrombosis, clots in the vein, were found to be using oral contraceptives compared to group without thrombosis. What type of study design is represented? So, in this study, 50% of women diagnosed with venous thrombosis, clots in the veins. What is the reason they found? Maybe she is using oral contraceptives. Contraceptives they use it to prevent unwanted pregnancy and compared to group without thrombosis. So comparing with other group, that group is one group is having thrombosis because of oral contraceptives, and one group is not having thrombosis. Comparison between the two groups. So this type of study is known as cross-sectional study. There is no cross-sectional here, no randomized randomly. It is not randomly, and a case control study, cohort study. So generally, like this is known as a case control study. It is known as case control study. Here we are studying some case. Okay, because of this, something is happening here. Like this is happening here. We are studying like in the form of a case. So that is simply case control study. So here this is simply answer. Okay. And here also I clearly mentioned that so what is cross-sectional study, what is randomized control study, what is case control study, what is cohort study. So like this MCQs don't leave. Maybe psychologically we will think that okay leave it. But focusing on this MCQ only making your rank towards top side. Like calculation, like tricky questions. So focus on there only. So what are your positive things that is easy for you? What are your negative areas? Please focus on that. So it is challenge. We have to accept the challenge. Okay. Next question. So regarding the next MCQ, what is the blood concentration ratio of trimethoprim and sulfamethoxazole after their administration in the ratio of 1:5? So trimethoprim 1, sulfamethoxazole 5 ratio given as a co-trimoxazole, an excellent drug for bacterial infections, treatment of bacterial infection, combination of sulfamethoxazole trimethoprim. And once it enter into the plasma, the concentration 1:5, 1:10, 1:1, 1:20. The answer is option D. The 1:5 ratio become explore to the 1:20. 1:20. Clear? Answer is 1:20. So here it is initially as a 1:5 combination and it is becoming a 1:20. Generally, when two drugs are taken alone, they are bacteriostatic, but in the combination they are bactericidal, they kill the bacteria. And the combination of trimethoprim sulfamethoxazole co-trimoxazole is a synergistic combination, inhibits two successive enzymes in the folic acid synthesis. So co-trimoxazole inhibit folic acid synthesis in the bacterium as a synergistic combination, as a sequential blocker. Okay, next. So regarding the next MCQ, which one of the following anemia is characterized by microcytic hypochromic red blood cells? Microcytic, reduction in the size. Hypochromic, reduction in the color of the blood cells. I hope you know that. So aplastic anemia, pernicious anemia, iron deficiency anemia, hemolytic anemia. So the answer is very clear. So this is a basic point only. So iron deficiency anemia is the answer because of microcytic hypochromic anemia. Hypochromic anemia. Answer is iron deficiency anemia. So here it is a explanation like hemolytic anemia breakdown of the cells. So next is the pernicious anemia, hemolytic anemia, aplastic anemia, iron deficiency anemia. So both microcytic, smaller than normal RBC, hypochromic, pale red blood cells due to reduced hemoglobin content. Hemoglobin content decreases, the color also reduces. Which one of the following is characteristic of a HIV infection? Increased. So which of the following is a characteristic feature? Increased B cell function, increased CD8 T cells, increased natural killer cell activity, depletion of CD4 T cells, depletion of CD4 cells, CD4 T cells, cluster differentiation cells, CD4 T cells. The CD4 T cells are eliminators of virus from the body, but HIV virus escape from these CD4 cells and expand their infection in the body. So, if the person is suffering from the HIV, there is a decrease in the levels of CD4 T cells. That is indication of person having HIV. One of the diagnostic tests. The answer is simply option D. Option D is the answer. Depletion of CD4 T cells. Next. So you can know helper T cells also known as CD4 T cells. They are responsible for eliminating the virus, but the virus escaping the CD4 cells enter into the body and spread its infection. All of the following are long-acting GnRH agonist except. So GnRH nothing but a gonadotropin releasing hormone. GnRH nothing but a gonadotropin releasing hormone. It releases gonadotropins. Okay, so cabergoline, buserelin, ganirelix, triptorelin. So here generally option A and C both are the answer because of that they removed the answer. The board which conducted last time Gpat exam they removed their question. So answer is option A and C. Definitely we will go for both A and C. So generally cabergoline is a dopamine receptor agonist. So here I clearly mentioned that according to the given question option A and C are correct. Hence this question is dropped by the NBEMS National Board Education of Medical Sciences 2025. Okay. So last time NBEMS board conducted Gpat exam. So this is the inhibit GH growth hormone release, inhibit prolactin release, enhance prolactin release, inhibit gonadotropin release, superactive GnRH agonist, GnRH antagonist. Which one of the following is used in the treatment of bronchial asthma and belongs to beta 2 sympathomimetics? Belongs to beta 2 sympathomimetics. Which one of the following is used in the treatment of bronchial asthma? Okay. And that is belongs to beta 2 receptor agonist, beta 2 sympathomimetics. So salmeterol, theophylline, ipratropium, ketotifen. So all this list of drugs are comes under anti-asthmatic classification. But here salmeterol is a selective beta 2 receptor agonist and effectively relax the bronchial smooth muscle, helps in the treatment of asthma. Theophylline, inhibitor of phosphodiesterase enzyme. Ipratropium bromide blocks type 3 muscarinic receptor and ketotifen having the other mechanism of action. So the answer is very simple. Salmeterol, salbutamol, terbutaline, all are selective beta 2 receptor agonist helps in the treatment of asthma. So this is a clear classification of our anti-asthmatic drugs. So MCQs with explanation and like this mentioning is very essential and definitely you will stay focused that will grab into your brain. And if you make that content more time in your brain, you have to go for simultaneous revisions, continuous revisions. Okay, go to the classification ones. Next. And yes, this is also continuation of classification. Which of the following anti-cancer medication causes hand-foot syndrome? Generally, hand-foot syndrome nothing but here one of the anti-cancer drug may cause hand-foot syndrome in the form of allergic reactions on the hands and foot. And the options like methotrexate, folic acid antagonist, vincristine, a plant derivative anti-cancer drug, doxorubicin, a naturally antibiotic in treatment of cancer, and capecitabine. I think unfortunately answer also appeared here. So capecitabine is an antimetabolite. So capecitabine, even 5 fluorouracil also causes a hand-foot syndrome. Also causes a hand-foot syndrome. So here it is a drugs and their toxicity. Drugs and their toxicity. Once go together. So drugs like capecitabine, a anti-metabolite from anti-cancer classification, and it causes hand-foot syndrome and diarrhea also as a side effect. Diarrhea also as a side effect. Which nasal decongestant is a selective alpha-2 adrenergic receptor agonist? Loratadine, oxymetazoline, cetirizine, montelukast. So, which of the following drug is a selective alpha-2 adrenergic receptor agonist? Alpha-2 receptors are generally located on the CNS. Okay. So, here loratadine a antihistamine, cetirizine a antihistamine, montelukast a cysteine leukotriene receptor blockers. Cysteine leukotriene receptor blocker helps in treatment of asthma. And answer is simply oxymetazoline is a selective alpha 2 receptor agonist here according to the options. So here again, so nasal decongestant. Nasal decongestant. Okay. So here we are directly asking the question that selective alpha 2 receptor agonist. Okay. Oxymetazoline is a sympathomimetic. It binds to the alpha adrenergic receptor. It binds to alpha 1 adrenergic receptor, alpha 2 adrenergic receptor, but it having high affinity for alpha 1 receptor. It used as a nasal decongestant, helps in the treatment of nasal congestion. When there is a decreasing function of our nose unable to function properly during the cold, we will feel, we will try our hard, but there is accumulation of mucus in the nose, we are unable to do it properly. So, because of stimulation of alpha 1 receptor, these drugs helps in the treatment of nasal congestion as a nasal decongestant. So, clearly, this oxymetazoline acts on alpha 1, alpha 2 receptor, but it having more affinity for the alpha 1 receptors. More affinity for the alpha 1 receptor. So, simply it is a relatively selective on alpha 2. The selective alpha 1 receptor, alpha 2 receptor like a agonist like clonidine. Clonidine is a selective alpha 2 receptor agonist, helps in the treatment of hypertension. So pressure, here they mention pressure agent. These are the agents, they increases pressure on the blood vessel. And cardiac stimulants, these are stimulates the cardiac muscle. So here it is a simply classification of sympathomimetics based on their clinical application. Pressure agent, increase of blood pressure, cardiac stimulants, and bronchodilator, nasal decongestant, CNS stimulant, anorectic, vesicorelaxants, uterine relaxants. So all these are sympathomimetics along with their clinical applications classification. Okay, next. After which phase of the clinical trial can a pharmaceutical company submit new drug application NDA to the licensing authority? That is very simple. So you know that before going into the market, they have to submit. Before going into the market means after completion of phase 3, they go for the market. Phase 4, post-marketing trials. Before entering into the market, their drug, they should submit application to NDA after phase 3. The answer is very simple. Phase 3, after completion of phase 3. So a new drug application submitted after successful completion of phase 1, phase 2, phase 3 clinical trial. Option is the phase 3 here. So here it is the drug discovery, preclinical phase, clinical trial phase, regulation, restricted marketing. So once go through here. So total 1 to 2 years, nearly 10 to 15 years is taking hardly to get a new drug into the market. Antiviral drugs used for the treatment of influenza act by inhibiting the enzyme. So here following are the antiviral drugs. They inhibit influenza enzyme in the virus. So what is that enzyme? So DNA polymerase, neuraminidase, reverse transcriptase, protease. So antiviral drugs helps in the treatment of influenza, a viral infection, by inhibiting the enzyme neuraminidase. By inhibiting the neuraminidase enzyme, it leads to decreasing spreading of virus infection from infected to non-infected cells. Protection of non-infected cells by inhibiting neuraminidase enzyme. Neuraminidase will make the spread of infection from infected to non-infected cells. Okay, the answer is very clear. Option B is the answer. Option B is the answer. Next, this is a classification of antiviral drugs. So here, and classification based on their application: anti-herpes drugs, treatment of viral herpes infection; anti-corona drug, remdesivir; anti-corona drug, remdesivir; remdesivir anti-coronavirus drug; anti-cytomegalovirus drug, treatment of cytomegalovirus infections; treatment of hepatitis infection; and treatment of influenza, amantadine, rimantadine, oseltamivir, zanamivir; and treatment of hepatitis B, treatment of hepatitis C. This is a classification of antiviral drugs according to their classification. Okay. So here, oseltamivir, zanamivir inhibit viral neuraminidase, inhibit release of daughter virions, inhibit the viral replication, decrease the spreading of virus infection from the infected to non-infected cells. Next. Here, serotonin type 2A or 2C inhibitor for treatment of migraine. For treatment of a migraine. So, which of the following drug is a serotonin type 2A or 2C receptor inhibitor that helps in the treatment of migraine? So, here, especially the drugs acting on the serotonin receptor, they help in the treatment of migraine. Especially the drugs like option A, methotrexate. Methotrexate is like a indirectly derivative of ergot alkaloids, methotrexate. Ergot alkaloids having their function on the serotonin receptor. Option A is the answer. So here list of the drugs are agonist, antagonist on the serotonin receptors along with their examples and their applications in the bracket. So here serotonin type 2A or 2C blockers, clozapine, a second generation antipsychotic, and methotrexate. Methotrexate helps in the treatment of a migraine. Okay. Now let's go through this table classification. Next. The next MCQ is which electrolyte imbalance is commonly associated with amphotericin B? Amphotericin B is a broad spectrum antifungal antibiotic, chemically polyene derivative. It is naturally from the organism Streptomyces nodosus. It is a natural antibiotic as antifungal and from the source of Streptomyces nodosus. Chemically, it is a polyene antibiotic naturally from the Streptomyces nodosus. So, which electrolyte depletion is common problem in amphotericin B treatment? Hyponatremia, decreasing sodium; hypokalemia, reduction in calcium; hypermagnesemia, excess magnesium; hypercalcemia, excess calcium. Hypokalemia is one of the major drawback of the amphotericin B treatment, and also it may cause nephrotoxicity also. So decreasing potassium levels, decreasing the muscle movements, fatigue to the muscle movements, and also causes low potassium also leads to cardiac arrhythmias. The same problem commonly observed in case of loop diuretics and triazide diuretics, hypokalemia. Hypokalemia leads to decreasing muscle movements, that is fatigue to muscles, and decreasing cardiac muscle movements, that is arrhythmias, abnormal rhythm of the heart. The answer is very simply hypokalemia. Hypokalemia is the answer. Okay. So here is the explanation. These are chemically polyene antibiotic. They produce many side effects, long-term side effects like anemia, CNS toxicity, etc. So go through it. Next MCQ. Regarding the next MCQ, A type 4 phosphodiesterase enzyme inhibitor used for treatment of COPD, chronic obstructive pulmonary disease. PDE, phosphodiesterase enzyme. Phosphodiesterase enzymes function in the body. They decrease the adenyl cyclase levels. They decrease the adenyl cyclase. They inhibit the adenyl cyclase levels. Inhibition of adenyl cyclase levels reduces cyclic AMP. Here, one of the drug inhibiting phosphodiesterase enzyme 4 in the lungs helps in the treatment of COPD. So, roflumilast, reslizumab, chromoglycate, montulukast. So, these are drugs all are related to lung disorders treatment only. And roflumilast selectively inhibit phosphodiesterase enzyme and increases adenyl cyclase enzyme action. Increased adenyl cyclase enzyme action increases cyclic adenosine monophosphate. The cyclic adenosine monophosphate on the lungs causes dilation of bronchial smooth muscle. Dilation of bronchial smooth muscle is essential in the treatment of COPD lung disease. Okay, so phosphodiesterase enzyme inhibition leads to increasing adenyl cyclase. Increasing adenyl cyclase increase the cyclic AMP. Increased cyclic AMP levels on the smooth muscle lungs causes relaxation, dilation. Same cyclic AMP on the heart contraction. So same secondary messenger. When location is changed, the response also changed. The answer is simply option A. Next. So bambuterol. So bambuterol is a prodrug of albuterol, indacaterol, terbutaline, salmeterol. All these are selective beta 2 receptor agonist, helps in the treatment of asthma by relaxing bronchial smooth muscle. And here, generally, terbutaline. Terbutaline is a prodrug of bambuterol. Bamboo, nothing but it is a wood tube. So like bamboo, like a tube structure. So tube, terbutaline. Terbutaline is a prodrug of bambuterol. Bamboo, tube, terbu. You can remember like this easily. Answer is the option C, terbutaline. And here it is the explanation along with the explanation. Nothing but along with more points and details. So next MCQ. So regarding the next MCQ, which of the following pair is correctly matched in terms of laxative type and its mechanism of action? Lubiprostone, fecal softener, lactose, stimulant laxative, senna, bulk forming, procalopride, serotonin type 4 receptor agonist. Senna generally it is a stimulant laxative by causing irritation. Lactose is a osmotic one. Lubiprostone is a prostaglandin derivative. So the correct matching is a procalopride is a serotonin 4 receptor agonist. Answer is option D. Option D is the answer. So observe the question and the answer is option B. And here it is a clear explanation along with the classification of laxatives, purgatives, cathartics. So all are same function but the dose is differing. The dose is differing. Okay, so this is a detailed classification regarding the laxatives. Next. So this is also one of the tricky question like that from anatomy point of view. What score range is categorized as a probable in the Naranjo casualty assessment scale for adverse drug reaction? So it is questions related like a pharmacovigilance. So what is the range, scale range to assess the adverse effect, adverse drug reactions according to Naranjo casualty assessment scale? So here, what is the score range? Categorized as a probable. So greater than or equal to 9, less than or equal to 0, 5 to 8, 1 to 4. Generally 5 to 8 is the probable. There is a chance of adverse drug reaction according to this mention scale. According to this mention scale. So this is the explanation and this is the table they given. So probable ADR in the range of 5 to 8 score. In the range of 5 to 8 score. Next. So, next question. Bempedoic acid, a dicarboxylic acid, a new class of cholesterol lowering drug that act by inhibiting apolipoprotein B100 synthesis pro-protein convertase subtilism or hexene type 9, ATP citrate lyase, microsomal triglyceride transfer protein. So, bempedoic acid is recently approved drug from the new class as a anti-hyperlipidemic or hypolipidemic. It acts by inhibiting ATP citrate lyase. By inhibition of this enzyme, it reduces the production of acetyl coenzyme A, which is essential for initiation of cholesterol biosynthesis. Answer is the ATP citrate lyase. So, what happens if this enzyme is inhibited? What happens if this enzyme is inhibited? So it leads to the, it mainly helps in the treatment of hyperlipidemia where statins are not effectively works, where statins not effectively work. And this cholesterol biosynthesis pathway, by inhibiting these drugs work by inhibiting ATP citrate lyase. ATP citrate lyase enzyme involved in the production of acetyl coenzyme A, which is essential for cholesterol synthesis in the liver. If this acetyl coenzyme A is not formed, then no cholesterol synthesis in the liver. For that no formation of acetyl coenzyme A, we have to inhibit ATP citrate lyase in the body. So this bempedoic acid inhibit this enzyme and decrease cholesterol biosynthesis in the liver. Next. Which of the following causes shift in the oxygen hemoglobin dissociation curve to the right side? Decreased H plus concentration, increased partial pressure of oxygen, increased partial pressure of carbon dioxide, decreased partial pressure of carbon dioxide. Generally, increased partial pressure of carbon dioxide causes shift in the oxygen hemoglobin dissociation curve towards the right. If there is a more oxygen concentration, it's towards the left. Okay, so here the clear answer is increased partial pressure of carbon dioxide. Increased partial pressure of carbon dioxide is also known as terminologically, regarding terminology, hypercapnia. Excess carbon dioxide levels in the lungs. This hypercapnia is generally a drawback of drugs like morphine as well as deep tubocuralin. So shift to the right because of decrease in partial pressure of oxygen, increase in partial pressure of carbon dioxide, increase in H plus ion concentration, and a decrease in the pH acidity. So this causes shifting towards the right side and shifting towards the left in fetal blood because fetal hemoglobin has got more affinity for oxygen than the adult hemoglobin. Decrease in H plus concentration, increase in pH alkalinity, shift towards the left side. Shift towards the left side. So this is regarding our MCQs from the pharmacology from Gpat 2025 question paper. Okay, so all the best. Subscribe to GDC English classes. We are doing a shorts in the unique way. We are posting in our channel. Please follow that. If you are having any new ideas in the form of delivering the teaching or concepts or basic, let us know. Definitely we will make it, take it to forward. All the best.